coming again. As you know me, my name is Dr. Jesus Gomez. I'm an oral maxillofacial surgeon, full-time faculty of the University of Miami, Jackson Memorial Medical Center. And we're here today because Marlie is back. Okay? We're lucky enough, to have the chance, to bring her to the United States again, to continue, her medical treatment. At this point, the situation in Haiti, the health situation over there, the general situation of the population is bad enough to have a person that has been partially disabled related to this deformity affecting, every single bone of her body. And we are lucky, to have the chance, to bring her to the United States again, to continue her medical care and to provide some of the treatment that, she will need, to require in order, to finish and complete, the final restoration of the functions and the final restoration of some of her personal appearance. At this time, Marlie, after an evaluation this week, Marlie is going to be ready in a few weeks to return to the operating room and to have some final touches of her face. There's some recurrence of the disease at the central portion, and that will require some excision and complex surgery to remove part of this mass that is affecting, the nasal cavity, and is also expanding a little bit, of the left side of the face. You're going to see her in a minute. But we're confident that, with the resources that we have here in the United States, and of course, with the support of the community, we're going to be able, to complete, her treatment. Okay.
Doctor, what is the challenge? Janelle was saying that she's having trouble breathing right now, and she also has some type of infection.
Well, her disease is something called a polystotic fibrous dysplasia. Polystotic fibrous dysplasia is not a tumor. It is a genetic disorder that affects every single one of the bone of her face and her body. What happened with this disease is that normal bone is being replaced by normal tissue that is growing in a faster rate. And at that time, what happened is some of the anatomical structures or vital structures of the face are being affected. In the 5 previous surgeries that I made, for her, pretty much, we were able to remove, I would say, 90% of the lesion. And this 90% of the lesion was the one that compromised, some of the vital structures, the nose, the eyes. But at this point, the lesion is growing back from the central portion of the base of the skull, growing out, obliterating some of the nasal passages. This is why we're going to have to come back and return to the nasal cavity and excise the portions of the lesion in order for her to breathe, normally again.
Is this something that you knew was going to happen, or is this something that just happened?
The problem with this disease, and following the literature, is that when the patient completes the skeletal growth, the lesion should stop. Marlie is getting very close, to that point. But again, the lesion is growing back, not at the same rate that was growing in the past, not with the same aggressive, or aggression, to some of the anatomical structures. But definitely, we're going to have to address, that part in order, to regain, some of these, normal breathing capability that she should have to live.
How much did the situation in Haiti complicate her health and her condition?
Well, that's a difficult question, because the problem in Haiti is not just the healthcare system is completely collapsed. They are a social problem. There is an economical, financial situation that is pretty much affecting every single one of the individuals that is living, in that island. With our kids or our patient that they're going back to Haiti, the situation is even worse. They don't have access to anything. Sometimes they don't even have access, to water. And it's our mission not to treat, do a surgery on one individual and send him back to an environment that pretty much will compromise or potentially can compromise, the final outcome. And I would say, the development of these, diseases, again. We have several patients that we are trying to make the best effort to bring them back to the United States to be sure that, that they're not going to get infected, that they're going to get, good nutrition, because at this point, part of our worries are pretty much focused on that, the wellness of these patients that we already treat. Again, our mission here is provide a comprehensive treatment. It's not just to do a surgery and send the patient back. Because we're not treating faces, we're not treating legs, we're not treating hearts. Pretty much we're treating human beings. And this is why, is our main concern, the condition or the general condition of this population in Haiti, because they don't have access to anything.
2 questions for you, doctor. First off, I know that the problem is monetary. You all need monetary donations. How much do you need in order to do this? And also, where does this next surgery lay in the big picture? Will there be many more for her, or is this the last one? Is this going to be an ongoing?
Well, we think that most probably this is going to be, and it's impossible for me, to make that prediction because again, I cannot control, the bony growth. We are hoping that the bony growth, or the bony growth, will stop once she completes, the skeletal growth. And this is going to happen probably in the next 18 months. Okay, we're expecting that. How much of this surgery or how much this surgery is going to cost, I cannot tell you, exactly the amount of money that we need. Because pretty much, surgery is one aspect of the financial, issues here. And the rest of that is coming from, pretty much how we keep these patients here. Some of these patients, they need family support. Some of these patients, they need a host family. Some of these patients, they need money to buy their food. That means that, for me to give you an estimate from the surgical part, I think that is not fair because, we don't need just money, to provide that. We need money also, to keep the patient, in the best possible conditions here in the United States.
Just a base though, how much does this sort of thing cost just in general?
Yeah, it's something that is going to get close to 150,000.
Doctor, are you trying to keep the children here permanently?
No, because I don't think that is our goal or our mission. Pretty much to extract this individual from the culture, from their countries, and bring them here to the United States. The International Kids Fund, Jackson Memorial Foundation, the University of Miami is not an immigration entity. Pretty much what we're trying to do is to provide the appropriate care here, and once the individual is ready to be reintroduced to their culture and their society, we send them back. Of course, we have these special situations, especially with Haiti, when we have the earthquake, and some of the conditions, the general conditions over there, are not allowing this individual, to gain, access, to the minimal conditions of normal life. But again, it's not our goal, and never will be our goal, to bring, people from outside the United States to keep them here. That's not our mission. That's not, our purpose. Pretty much, we provide the medical care and we ensure that all the conditions, related to the medical care are provided here in the United States. And hopefully, we're going to be able, to send every single one of these individuals, to the country of origin.
How vital is it for her to have this surgery? How vital is it?
Well, just imagine that now she has lost pretty much, all the capabilities, to breathe through the nose. Now she's breathing through the mouth. Breathing through the mouth, causes, some physiological, pretty much abnormalities, if I have the right word, because you're not warming the air enough. Pretty much, your throat is always, painful because you're breathing all the whole air, and you don't have, any of the nasal physiology pretty much, working and helping you to pretty much maintain, your normal capabilities. That means that, at this point, my main concern is that if I don't restore or I don't open the nasal passages again, she's going to continue to have this difficulty to breathe, and she's going to start to develop some difficulty to swallow too. This is why, I'm concentrating and I'm trying to do this, as soon as possible in order, to regain, her capability to breathe, through the nose.
Doctor, did you find this out this week? You said that she was brought in, was this a routine examination, then you determined she needs surgery. What led up to this point?
Okay, well, sometimes, what you're seeing over here is just, the tip of the iceberg. We have a lot of the behind the scenes. We have a huge organization that work here. We have been trying, to bring her here, I would say for almost, for a few months. After the earthquake, okay, we were very worried about, her condition. Not just her, but, all the kids that, that we have treated here at Jackson Memorial, University of Miami. And, we were, pretty much advocated, to make the efforts, to make the contact, or to at least, to ensure some of, the minimum, requirements, to keep these kids, safe, in Haiti. I mean, sometimes, these take, this takes a long process, and it takes the effort of a lot of people in our organization to bring these kids here. Of course, we have been in contact, over the phone with her. We sent pictures back and forth. But, the first time that I examined her personally was this week. But the effort, started, I would say a few months ago.
So I guess my question is, when did you determine that she would need this neck surgery? Was it this week after you saw what was in?
No,
Or you just
based on the pretty much all the information that we have from Haiti, and the description that we have, from the family members and the picture that they sent me, from Haiti, pretty much I knew that, that the lesion was coming back at the center of the face.
So what happens if you don't get the money? I mean, do you just start the surgery and wait to get the money, or?
I think maybe I can chime in on that one. The important part is that we never think in that way. We do work at a public hospital and we serve international children and children here in the U.S. that some procedures aren't covered by Medicaid. We never think that we won't get the money because we've had the support of our community from day one. They realize the importance, I think, that the mission and that we have, which is serving children that cannot get access to care. Whether, a lot of times it's not even because it's financial, it's because there's not the resources in their country of origin. And I think that everyone can relate to